Good evening, everyone. Magandang gabi, good morning, good afternoon, happy lunchtime, wherever in the world you may be. Morning, ang pag-uusapan natin is something that is very, very relevant. And I know that many of you have asked questions before in the comment sections. It's very relevant because we're currently in the middle of it. So ito yung ating pandemic, and how do we relate our lifestyle? What will it do for us sa pagtulong para ma-prevent yung mga, first of all, acquiring the infection. Second of all, if you do get the infection, then ano yung maaaring protection that it can confer to you? So I'm gonna give you all a chance to jump in. Let me enjoy my green tea. Ayan. Meron po tayong green tea. It's a cold morning. Fall season na po dito sa amin. So, if you don't know yet, ako nga po pala si Dr. Iris, one of the co-founders for Low Carb Convention. I am broadcasting in a few different platforms. I am also broadcasting in my own community, the Low Carb Fasting Holistic Wellness Community. It is a community with an international audience. Hopefully there will be some translations. I know many of you have many questions. I'll try to translate them in English. Okay lang naman po mag-Tagalog. We will likely edit this para everyone can understand. But mainly, the broadcast tonight, is for our mga kababayan. So jump in and pwede pong isulat yung mga questions dyan at titingnan natin isa-isa before we go on to discuss yung COVID-19 and how our lifestyle can help sa pag-prevent ng COVID-19. Yan, medyo mainit pa ang ating green tea. Okay, jump in everyone. Batiin ko lang yung mga nandito. Magandang gabi from Cabuyao, Laguna. Hello po. Mr. Reese Kang, one of our community members. Hello, Mr. Reese. Hi. Ito IKEA, yung parang store, IKEA or IKEA, Zenar Ranzabre. Hello. With the avocados. Good fat. Lucille Ortile is also here. Eileen Garcia is also here from Nova Scotia. Maraming salamat for tuning in. I think you are, ilang oras ba tayo different? So Nova Scotia po is also in Canada. Here in BC, it's very early. It's 6 a.m. Anong oras po tayo dyan sa Nova Scotia, Miss Eileen? And andito rin po si Miss Pressy. Hello po. Good to see you, Miss Pressy. Hopefully may matutunan tayo. Oh, from BC, one of my patients. Hi, Miss Lulu. Good morning. Thank you for tuning in quite early. Magandang gabi, everyone. From our moderator ng group natin, si Miss Maribel Kuramori. Miss Rosemary Huang, member din po ng ating community from Taiwan. Hello, Miss Rosemary. Good to see you here. Andito rin po si Bulakenya Eve. Magandang gabi po, Miss Eve. Sherilyn Apolinario is also here. Magandang gabi. Marilu Lumaybay from Laguna. Hello po yung mga friends natin sa Laguna. Mga kaibigan natin sa Maguindanao, si Mr. Jojo Bedar. Hello, sir. Magandang gabi po. And Cerezo Sara from North Wales. Hello. Maraming salamat po for tuning in. Anong oras na po dyan? Mga hapon na po yata. Hapon or lunchtime? Okay. So, yung iba po, mamaya na lang natin babatiin. So, tonight, ang topic natin is how can our lifestyle, so the combination of low carb and fasting lifestyle, how can that particular lifestyle prevent yung COVID-19, getting the COVID-19 infection, and kung sakali man na kayo ay magkaroon ng COVID-19, paano ito makakatulong na lesser yung symptoms? Kailangan lang natin maintindihan yung science behind it, yung mga pathophysiology para po lalong lumakas yung ating resolve na ipagpatuloy natin itong lifestyle na ito. So again, I want to state the disclaimer. So lagi po, consult with your doctor. This is general advice that I'm giving you. I am here to mainly discuss yung science behind paano nga ba tayo na-infect ng COVID, paano nakakatulong yung ating lifestyle dito. Hindi ko po sinasabi na sa pamamagitan ng lifestyle na ito, hindi na kayo ever magkaka-COVID. Kailangan pong maintindihan yan because of course there are other factors too in play na magdidikta kung sino ang maaapektuhan ng sakit na ito, and we still don't know everything about it. As you all know, tayo ay continuously learning from this pandemic. There are so many unanswered questions. We do have some basic information, and yun po yung i-share ko. And also, the known science already behind it as well. So, mainly pertaining to pathophysiology, ano ba yung epekto ng asukal, mga dati na po nating alam, established truths, and how it correlates with the disease. So, yun po yung kailangan nating maintindihan. Ano po, again, hindi po ito, in our community sa low carb con, as you know, give you that impression. Hindi po yan ang advocacy ng low carb. Tayo po laging, we look at the evidence, we try to weigh, hoping to give you also balanced evidence po. So, I discussed before yung iba't ibang quality of evidence. Nalaman nyo po, kung hindi nyo napanood yung broadcast ko na yun, I discussed the different levels of evidence and ano yung mga sinasite natin, so you can have an informed choice, informed decision in discussion with your medical providers. Again, hindi po ito pagbibigay ng maling pag-asa, kundi papakita lang sa inyo yung talagang agham. So the science that's already existing, that we already know, and how we can correlate. Kasi yung science, pag hindi mo in-apply, minsan, mahirap siyang intindihin, unang-una, right? Ikalawa, yung mga ginagawa natin, pag if it doesn't make sense to you, you're not gonna do it. So for example, nandito kayo sa broadcast na ito dahil meron kayong friend or nakita ninyo itong low carb convention portal or yung Filipino Success Movement portal or even my own platform. And hindi pa rin ninyo naiintindihan yung foundations ng science behind this, then hindi kayo maiengganyo gawin ito. Kasi for you, it doesn't make sense. Okay, so ito na po siya. So I'm gonna pull up the first slide. So, obesity, right? Ano ba yung kina-counter ng ating lifestyle in terms of medical conditions? So, basically, lifestyle, yung tinatawag nating metabolic syndrome. This is the state kung saan meron tayong insulin resistance. So, kasi una-una sa nagsisimula yan. So, back to the very basics, sa pagkakaroon ng high carb lifestyle, nag-i-induce ito ng tinatawag na insulin resistant state. At itong insulin resistance will lead to a few different, yung spectrum ng diseases. Ano po? So, diabetes, nandyan yung mataas yung cholesterol. Siyempre, kaakibat ng diabetes, nandun na rin yung paglaki ng tiyan, obesity, and kasama niyan ay yung mataas na presyon. And also, kung meron tayong napakaraming carbohydrate consumption, papasok dyan ngayon ang liver effect, so fatty liver. So yun yung major components ng metabolic syndrome. Ngayon, bakit sinasabi, nakita nyo yan, just from the very beginning pa lang po, nitong pandemic na ito, nakita na ang mga taong most vulnerable, pinaka naaapektuhan ng COVID ay mga taong exactly may mga ganitong medical conditions, and also yung mga kasama na disease states nito. For example, mga taong merong kidney diseases, very common. Nakikita natin yan sa mga taong diabetics, sa mga taong may high blood pressure. Eventually, nagkakaroon sila ng kidney disease. So nakita rin yan, mga taong may kidney disease are also people who suffer a lot from yung COVID and yung, not only getting the COVID, but also kapag sila ay may sakit na, matindihang symptoms ang meron sila. Okay, so yung kidney disease is one of that. Mga tao na nagkaroon na ng stroke, again, related na naman ito doon sa metabolic syndrome. Siyempre nga naman, pag ikaw taas ang presyon mo, pag nagkaroon ka ng, from the insulin resistant state, mas mataas yung chances mo of getting stroke. And mga taong may heart disease. So nalaman natin yan just from the very beginning na ang mga taong may mataas na may mga heart disease ay higher risk of getting COVID. And again, it all boils down to the main pathophysiology, insulin resistance. So insulin resistance. So itong first slide, although ang focus dito is, as you can see here, Tanggalin ko lang po itong comments. Sandali lang. I'm just trying to find. Hello po, Miss Ella Marie. Okay. So, here, the starting point is still yung insulin resistant state. Although sa itong slide na ito, nakikita ninyo ang depiction, which is, type 2 diabetes, obesity, cardiovascular comorbidities, ang pinakasimula pa rin yan is the insulin resistant state. Ngayon, bakit nga ba itong estado na ito? Why is this state correlated with so much morbidity? So, ibig sabihin yung pagkakasakit and mortality, which is yung pagkamatay with COVID. And this is because itong status ng pagkakaroon ng diabetes, obesity, cardiovascular comorbidities will cause an imbalance sa isang napakahalagang system sa katawan natin, which is the RAAS system. So, RAAS, renin-angiotensin-aldosterone system, I don't want to overwhelm you with too much. Pinapakita ko lang kasi ngayon yung agham po, the science, yung talagang pathway niya. Ngayon, ano nga ba itong role na ginagampanan nitong RAAS? Bakit ayaw natin na magkaroon siya ng imbalance? Kung walang imbalance itong RAS, so I'm gonna pull it up, hindi rin magkakaroon ng mababa ang chance na yung COVID ay makakapasok sa katawan. Kasi remember, this is a virus, right? It needs to enter the cells. Viruses, they cannot live on their own. Kailangan silang pumasok at mag-invade before po sila mag-multiply, before sila mag-cause ng damage. Kailangan nila ng host cell, which is tayo nga, yung human cell in this case, specifically for COVID. And ang mangyayari dyan, they use a specific pathway of entry. So yung entry point ng virus po na ito, particularly yung COVID-19, iba't ibang virus, iba't ibang ginagamit niya na entry point. Tingnan nyo dito sa larawan sa kanan. So nakikita nyo po yung mga pula-pula dyan sa bilog. So that's a COVID-19, right? It has what we call yung mga spike proteins na kanyang ginagamit para mag-bind or dumikit doon sa entry point. And tingnan nyo po yan, yung kanyang spike proteins will use yung ACE2, which is itong angiotensin converting enzyme na matatagpuan natin sa ating baga, and yung DPP4. Yung DPP4, isa rin po yung pathway na dati akala nila yung MERS lang. MERS, which is also similar sa SARS-CoV-2, So akala nila MERS lang yung gumagamit niyan. But there is evidence now na ginagamit din siya ni COVID para makapasok. So again, tatandaan po, si ACE2, so that's the receptor na isa. The other one is DPP4. So now, magbabind, didikit ngayon yung protina, yung spike protein ni COVID doon sa mga entry points na yan. And in that way, makakapasok po si COVID. Saan matatagpuan yung karamihang ACE2 receptors? Sa lining po sa alveoli ng ating lungs. So yung mga maliliit na units po ng ating baga. Kaya nga po, if you already know this, yung pinakaunang mga simptomas will be cough and fever, and pinakadulong simptomas why most people succumb to the disease is because of respiratory failure or myocarditis, yung sa puso naman po. But most of the time, it's from the overwhelm ng ating baga. Hindi na makayanan. And hindi lang yan direct toxic effect po, na, pumasok yung COVID tapos nagkaroon ng direct effect. No, it's actually what happens after niya mabind. So, tingnan po natin, balikan ulit natin tong slide na ito. So, ito yung mga nangyayari. So, once mabind yan, nagkakaroon nitong widespread, itong mga inflammation na yan, yung pagkipot ng daluyan ng hangin, so bronchoconstriction, inflammation, and sa heart natin, magkakaroon ng inflammation ng heart natin to the point na magkakaroon ng heart failure, magkakaroon ng dysfunction sa pacemaker capacity ng heart natin, so arrhythmia, and then sa mga ugat, will be just, a generalized dysfunction. Umaabot pa sa point na nagkakaroon ng effect sa blood clotting and yung pagtunaw, pagkalusaw ng clot na yon. So, it's a very dysregulated thing and karamihan ng tao rin can succumb to that na either maging super lapot yung dugo or super, what's the opposite of lapot? Super lapot or super, yung opposite nun, yung masyadong ano siya, runny. So, I don't know the Tagalog nun. But anyway, it is not normal to have that kasi either you will clot, so maaari kang, ma-block yung, magkaroon ka ng mga strokes or DVT, or maaari namang hindi siya the opposite ng super, ano siya, dapat masyado siyang what do you call that? Hindi ko ano yung Tagalog term niya, but you can bleed a lot. So, ito yung tinatawag nating DIC, so disseminated intravascular coagulation. It's both extremes, either mag-clot ka masyado or magkaroon ka ng bleeding, and that can, of course, yung imbalance na yan can cause death. So, napakarami po niyang effects, and this won't happen kung hindi nag-start sa pagpasok ng virus. Ngayon, ano ba yung nangyayari sa obesity? How do we directly relate yung state ng insulin resistance, itong state ng obesity, diabetes, cardiovascular status? Ang issue kasi dyan, sa mga estado na ito, the RAS system has an imbalance. Mas tumataas yung receptors po natin for the itong ACE2 receptors, DPP4 receptors, dumarami po yan. So, since sila ang ginagamit na entry point ng virus, then what will happen? Kung syempre mas maraming gate na pwedeng pasukan, mas makakapasok yung virus. So, again, yung estado ng pagkakaroon ng mataas na asukal sa katawan, sa dugo, that leads to insulin resistance will produce more of the gates. Itong mga gates na ito, ACE2 receptors and DPP4 receptors na ginagamit ng virus para makapasok sa katawan at mag-cause ng damage. And also remember, guys, that the high, tandaan po natin na yung type 2 diabetes, so look at this comparison. Ang mga healthy na tao, they have this harmony. Meron silang balanse sa loob ng katawan. The body knows when to do certain things. The body knows when to pull back a little bit. So sa isang healthy na tao, normal yung kanyang paglapot ng dugo, yung kanyang pag-regulate ng inflammation, mga ganyan po, pagbukas ng ugat. Sa mga taong may diabetes, so here, nakikita nyo sa second part, yung RAS dysregulation part, dito nagkakaroon ng issue doon sa pagkipot at pagbukas ng mga ugat, so that's the vasoconstriction, yung paglapot ng dugo, so the profibrotic effect na nakikita nyo dito, yung inflammation po, we already know from the get-go na ang state of having high sugar is already a pro-inflammatory state. Kapag po kayo ay, pansinin nyo po, kung kayo ay diabetic, napakadali po ninyong kapitan ng mga infections. Dahil itong estado ng pagiging diabetic, yung pagkakaroon ng mataas na asukal sa katawan, is already pro-inflammatory kahit wala pang COVID. So pro-inflammatory na po siya, kaya nga po, yung mga tao may diabetes and all the consequences nito, usually nagko-complain not only of frequent infections, pero tiredness, right? Kasi the body is constantly in a pro-inflammatory state. Laging naka-hyperdrive yung mga inflammation factors ng katawan nyo. Kaya nakakapagod po yun, imagine. Wala namang kailangang kalabanin, pero laging naka-ready yung mga sundalo ng katawan ninyo. So that causes a lot of tiredness, fatigue, yung mga kasukasuan masakit, parang body aches all the time. But sometimes this inflammation causes this widespread pain. So, nandyan na in the very beginning, hindi ka na nga, you don't already feel well dahil sa mataas na asukal mo sa katawan, dagdaghan pa, papasok pa ngayon si COVID na mismong sa sarili niya also stimulates itong tinatawag nating the end result, yung pinakamatindi talagang bakit namamatay mga tao from COVID, it's the cytokine storm. Itong mga inflammatory reactions na na nangyayari kapag ang COVID ay malalang-malala. So the critically ill patients, ano ba yung proportion nito? So usually, according sa bagong data, 80% of the people will have mild infections. So sa lahat-lahat na nagka-COVID, 80% makaka-recover. Merong mga around 14-15% who will have lung issues, yung medyo matindi-tindi but not critical. So matindi, yung talagang oospitalin, yung pupunta sa ospital, magkakaroon ng support, oxygen or whatever. However, makakapag-ano pa rin sila, makakapag-survive pa rin sila, sometimes with long-term sequela. And then finally, meron tayong yung 5% na talagang critical and, many of these people won't make it. And isa sa mga factors na nakita nila, so may mga studies po na lumalabas about this, isa sa mga factors na nakikita nila, yung mga tao, it's like a predictor. Predictor kung sino ang mapupunta ng ICU at sino ang malamang na mamamatay from COVID. One of these factors is having high sugar. High sugar sa dugo on admission. So nung kanilang inadmit itong mga tao na ito, napansin na mataas yung asukal sa katawan. So who are these people? Mainly obese, mainly with diabetes, and all the comorbidities ng disease na ito. So may mga heart disease na sila, meron na silang existing kidney dysfunction dahil nga because of the insulin resistant state, right? Marami ng damage organ systems nila. So itong mga taong ito, ang usually nag-end up sa critical care, right? Kasi sila yung, in the beginning, ang kanilang katawan ay already in the pro-inflammatory state. Dagdagan pa natin ng cytokine storm na ito dahil nga very highly inflammatory. Kung mataas yung iyong ACE2 at DPP4 sa katawan, then what will happen? Increased morbidity and lalo na mortality. So pagkamatay. Okay? So kung hindi pa po kayo kumbinsido tungkol sa lifestyle na ito from before, really now is the time. Kung hindi kayo natatakot sa mga, effects ng, let's say, maaaring magka-stroke, magka-heart disease, at least man lamang, ito na lang na part na ito which is very applicable to the current situation. Kung tayo ay bababaan natin yung ating carb intake at tayo ay magfa-fasting, bababa ngayon itong ACE2 receptors natin, bababa itong DPP4 receptors, mas mababa ang chance na ang virus makakapasok. Mai-restore natin, maibabalik natin yung balanse, itong RAS imbalance na ito na nakikita sa mga taong may insulin resistance, manunumbalik po sa normal. Yung mga inflammation markers na tumataas sa pamamagitan ng pagkakaroon ng lifestyle na ganyan, babalik din siya sa normal. And most especially po with fasting, when you fast, fasting, so one of the key players sa inflammation, let me see kung nandito siya, one of the key players sa inflammation is itong, tingnan nyo po dito sa baba, yung IL-6. The IL-6 is key factor yan sa inflammation, and that's the thing that leads to the respiratory failure na nangyayari sa COVID. Yan po has been shown in the research, even nung wala pa pong COVID, sa mga tao pa lamang, they were doing studies, for example, rheumatoid arthritis, nakita po na talagang napapababa yung IL-6 na yan sa pamamagitan ng fasting. So fasting or prolonged keto diet. So keto diet na 8 weeks or more. And again, remember, paano ba yung keto diet? That's 20 grams or less. Ano po? So it has a direct effect sa IL-6, which is the key modulator po nitong cytokine storm na ito na nangyayari. So imagine kung nagagawa yan ng keto, tsaka ng fasting, so wala yung IL-6 na yan, then you will have a lower chance, right? Even if ma-infect ka ng COVID, and we've seen this in our communities, mga tao pong nagka-COVID sa community natin, either very mild ang symptom, wala ngang fever yung iba, talagang walang, pang-amoy, panlasa, mga ganun lang, very mild. Some people don't even have symptoms. Dahil po, hindi talaga mataas yung kanilang inflammatory response. And that's exactly because of itong low substrate. Mababa yung asukal. So ngayon, lahat ng downstream, lahat ng mga naapektuhan ng pagkakaroon ng mababang asukal,
especially mga inflammatory markers, mababa rin syempre. And so kung mababa yun, tapos mababa pa yung gate, mababa yung portal of entry, remember, pag ma-restore mo ang balance na yan, kung saan bababa ang ACE2 at DPP4 na ginagamit ng virus to enter, then less chances ka rin even to have COVID. So, very important po yan. Again, I'm not saying na yan lamang yung pamamaraan, but it's already available to you. It's free, it's natural. Merong science behind it. Kung meron mang ibang dahilan kung bakit magkakaroon ka ng COVID kasi hindi natin alam kung may mga iba pang receptors at play, then at least you've done your best doon sa pinakaalam talaga natin na pathophysiology niya. Right? The data is out. Lahat ng mga vulnerable people are people with insulin resistant states. So if you can at least lower the insulin resistant state, babaan mo yung asukal sa katawan mo through low carb nutrition and fasting, mga natural na pamamaraan. Hindi mo kailangan bumili ng gamot na mamahalin. Natural na pamamaraan, makakasave ka pa nga. Kasi pandemic, takot silang magutom. But in reality, they don't know that the fasting will save them. Again, fasting is different from starvation. Fasting is voluntary. Alam mo na marami siyang magandang effects sa katawan mo. So, gagawin mo siya voluntarily. It has all these, all the, what do you call that? All the good effects. So, longevity, autophagy, hindi po ba? Hindi lang kasi yan pang weight loss. It's great if you're gonna use it for weight loss. It's very effective. But longer term, na andun yung pagpapahaba ng buhay, pagkakaroon ng better function, once ikaw ay talagang regular sa pagpa-fast mo, sa paglo-low carb mo, you become a fat burner. Napakaraming benefits ng pagiging fat burner, right? It's metabolism-wise, and I will talk to you again. Magkakaroon ako ng live broadcast about our way of life and cancer. I think this is another thing kailangan malaman ng mga tao, the interplay. Cancer is mainly a metabolic disease. Akala nung una ay genetic lang. But it's an error in metabolism. And there is a big role that nutrition plays in cancer. And lumalabas na po yung mga evidence about this. Nagiging more mainstream na siya. And again, nakabase siya sa pathophysiology, sa science, sa imbalance ng nutrition and cancer cell metabolism. So pag-uusapan natin yan in the future. So yun lang po ang gusto kong ibahagi sa inyo about COVID, really stressing to you the importance of, ito nga yung kanyang pathophysiology, the importance of pababain natin yung likelihood na makapasok siya. So yung ACE2 at DPP4 pathways, kung yan ay mas konti, lesser chance na makuha natin, then less yung cytotoxic effect. So number one. Number two, less yung effect sa ating RAS system that affects, later down the road, mga heart function and the inflammation. Less yung number three, endothelial damage. So ito yung mga problema sa pag-clot, or pagiging masyadong prone to bleeding natin. And finally, yung dysregulated immune response, yung cytokine storm na pinag-usapan natin kanina, less lahat yan. It all starts from pinaka-source. So, high glucose in the blood, insulin-resistant state will promote the cascade. Kung mababa ang glucose dahil naglo-low carb, nagfa-fasting, mababa ang chances to get this disease, and even kung makuha man ang disease, mababa ang chances na you will end up very sick from it kasi your body is able to fight it off dahil yung body mo is not in the pro-inflammatory state, like someone who will not have this lifestyle. So yan po ang kailangan maintindihan dito. And let me see mga questions po related to COVID. So ngayon we'll focus on COVID po. So tingnan natin yung mga questions dito. Naghahanap po ako ng questions. Kung meron kayong gustong itanong, yung mga bagong-bago po sa lifestyle na ito, please get in touch with our admin. Kung hindi pa kayo nakaka-join sa mga various communities natin, join all of the communities. Lahat ng communities are very helpful. So We have our own community, yung Low Carb Fasting Holistic Wellness Community. Join kayo dyan. Join din po sa LCIF, Life Without Rice, Low Carb Fasting Feasting, One Keto Society, Kifi, Dietary Philippines. Lahat po, join kayo. Bawat association merong naitutulong, merong resources. Sa particular community ko, pinakita ko kagabi, napakaraming resources doon. We have food guides, ito, mga ganyan, mga guides, mga ganito, things to help you in your journey. Lahat po yan libre, lahat po yan nandun para po magamit ninyo. Mga ganyan po, para maintindihan lalo itong lifestyle na ito. So, join lang po at para makita doon lahat ng mga resources. And yung iba po na talagang super beginner, very important po na, sandali lang, hinahanap ko ito. Very important sa mga beginners na talagang basahin lahat itong resources na ito bago mag-start. Meron tayong step-by-step guide. Yan po yung step-by-step guide. Nasa communities po yan. So, tingnan ko po. Sino ba ang may tanong dito regarding... Okay. So, great question, Ms. Sophia Lee. How po mag-fasting? So, there is a step-by-step process to it. You don't have to go fasting right away. You need to ease into it. And the only way to do that would be foundational. Yung foundational basis ng lifestyle na ito, go low carb first. So, Sophia, if you can join, makikita mo dito sa ating guide, first step, start by going low carb. So, yan yung step-by-step. Low carb 1 to 2 weeks, i-download yung nutrition guide na makikita sa group, which is this. Pagka-download ng nutrition guide na yan, i-follow natin. Kuha tayo ng mga idea sa community members. Maraming community members na nagpo-post ng kanilang pagkain, how they are creating their low carb meals. Ayan, iba't ibang posting, iba't ibang uri ng mga pagkain, lahat low carb, para magkaroon ka ng idea, yan pala yung dapat kainin. And then after that, susunod na proseso po natin, pag tayo fat adapted na, saka lang tayo makakapag-fasting. So again, sa fasting, maraming iba't ibang pamamaraan, 16-8, 18-6, OMAD, so 1 meal a day, TMAD, 2 meals a day. Yan ay mangyayari lamang kung kayo ay maglo-low carb muna. Mag-fail ang inyong pagfa-fasting kung hindi kayo maglo-low carb, hindi po ninyo masussustain. Why? Kasi yung hunger signals hindi pa ganun ka-regulated. Magugutom kayo at usually it will fail. You need to go low carb first. So yun po yung doon. And paki-follow yung step-by-step guide. May welcome packages tayo para sa mga new members natin. Para magabayan kayo ng tuloy-tuloy. And then, sino pa po ang may tanong? Hinahanap ko lang po ang mga katanungan. Okay, so this one is not really related. Hindi po ito related sa low carb. Again, very important to get the check, laboratory test. Maaring may iba pang cause yung kanyang iron and vitamin D. Obviously, vitamin D, kung nasa Philippines kayo, there should not have a reason to have low vitamin D. Kasi just, 15-minute exposure sa sun will reverse that. Pero yung iron, maraming iba't ibang dahilan po yan. Work closely with your doctor. High carb directly, wala naman siyang effect dyan sa pagkakaroon ng low iron. Low iron can exist even without high carb diet. However, to optimize the health, we still recommend low carb. Okay, so ito naman, Ms. Desi, again, this is a blanket advice. You have to contact your own doctor regarding this. But if you ask me anong mga panel ang aking order, so 10 months na daw siya nag-low carb diet, anong dapat ipa-lab test at this point para malaman kung naging effective, kung tama ang low carb sa akin for the past 10 months. So usually, metabolic panel. So get usually mga sugar natin, sugar levels. I normally check yung fasting glucose, A1C, ACR, tina-check ko rin syempre yung lipid profile, syempre yung iba pang objective measures like your blood pressure. I check the kidney function. I normally check yung liver function. So metabolic profile po ito. So alam na po yan. Kapag nagkonsulta kayo sa doktor, they usually will know what to order. But those are the things that I normally check. Metabolic panel po. And depende din yan sa country. Kasi pag dito sa amin, sa Canada, is very comprehensive. I really order halos lahat. Okay? And sino pa po ang merong tanong? So ito, nakakakalbo ba ang keto diet? Usually in the beginning phases, nagkakaroon, this will not happen to all people, pero in the beginning phases, some people will lose hair. Pero hindi naman siya dapat makakalbo. If nagkakaroon ng ganong kalbo, there are a few important things to note here. Siyempre, stage of life, kasi meron tayong tinatawag na related sa age. Ano po, kahit babae, mapalalaki man, mapababae, can go through a phase na talagang nag-hair loss from the hormones. So, depende po yan doon. But the hair loss that's connected to paglo-low carb is temporary. Tatandaan natin yung hair natin goes through a cycle. It takes a few months to restore it. So, kung talagang tuluyang nakalbo, you have to find other reasons for that. Hindi dapat na makakalbo ka ng tuluyan from the low carb lifestyle. Okay? So there must be other reasons. Sometimes stress can cause yung tinatawag nating alopecia areata, which is nakakalbo sa isang parte lamang. So stress-related yun. Yung isa naman na global yung pagkakakalbo niya, mainly hormones yun. So either, andropause, menopause can do that, or there may be some disease states, organic disease states. So pasuri po tayo. Again, for low carb, it is a transient effect. Usually in maybe 3-4 months, you will start to regain that hair kung sa low carb lifestyle po ninyo nakuha. Dili ang period, Miss Sophia. Yes, sometimes habang nag-a-adjust tayo sa lifestyle nito, especially if you've lost a lot of weight, makaka-affect talaga yan sa cycles. But again, this is transient. And kung pagpe-persist ito, again, very important, sa lahat ng sinasagot kong tanong dito, guys, always have your bill of health checked muna. Kasi there are also other organic causes. When I say organic, ito yung mga disease states na hindi related sa low carb. So for example, delayed ng period dahil merong issue sa hormone na hindi naman related sa low carb, then that has to be checked. So say for example, meron kang prolactin producing tumor sa brain mo that can cause a delay in the period, hindi siya related sa low carb. So it's always good to check with your doctor always, right? Paggawa tayo ng mga metabolic profile, hormone profiles, depending on inyong medical condition before i-assume na low carb yun. Ngayon, ito ba ay maaaring maging epekto ng low carb? Yes. So maaaring maka-apekto ang pag-fasting, ang paglo-low carb dahil sa weight loss na nangyayari, na apektuhan yung ating HPA axis, which is yung hormone signaling. However, again, this is transient. So kapag tayo ay nag-settle down na yung system natin, transient lang po siya, dapat manumbalik sa dati. Pero posibleng side effect po ito. However, still get your whole metabolic profile check, yung inyong mga laboratory na kailangan gawin, kailangan ma-check po yan. So ito, younger age. So how young po? We have Dr. Brian from EBS Wellness, who is our pediatrician, low-carb practitioner. And si Dr. Brian ay nag-share ng kanyang learning po doon sa low-carb convention. Yung mga hindi po naka-attend ng convention, punta po kayo sa low-carb con page, and doon sa top, nandoon yung way to access the convention. And isa po sa mga diniscuss ni Dr. Brian, obviously yung application nito sa pediatric age. If you don't already know, yung low-carb lifestyle, specifically yung ketogenic diet po, has been used for a long time, since the early part of this century, to treat epilepsy in kids. So, alam natin na it can be safely done sa pamamagitan ng pagkakaroon ng patnubay ng doktor, even sa mga bata. However, it's still best, especially kasi mga bata will have their needs as they grow. I will just recommend siguro to cut down all the mga processed kasi sa atin. Minsan, di ba, love language ng Pilipino, pagkain. Minsan, akala natin pagmamahal yun. Yung pinapakita na, bibili ko ng treats itong bata, sweets, chocolates, candy. So kahit lamang po tanggalin natin yung mga gano'n, yung mga processed na mga pagkain, yung mga kumbaga hindi naman tunay na pagkain, right? Kasi these are processed things, napakataas ng mga fructose, high fructose corn syrup niyan, tataas ng sugar, yung mga carbonated drinks, colored drinks, juices. Kahit lamang po yun lang ang tanggalin natin at bigyan natin ng mga bata ng natural na pagkain. So by natural, meaning pag karne, yung karne talagang kayo ang nag-season at kayo ang nagluto versus for example hotdog, right? So the more natural the food is, the healthier it is. Sa pamamagitan lamang ng gano'n, yung pag-cut down ng mga colored drinks, ng mga processed food, usually ang mangyayari diyan at ang fini-feed niyo lang sa bata is natural food. Usually low carb na po 'yan, eh. Kasi tatanggalan na rin ninyo yung mga unnecessary na mga carbs like for example, yung masyadong maraming tinapay, tinapay na nga tapos yung palaman pa is jam na punong-punong-puno ng sugar. Usually parang mga nasa 60 grams yata yung sugar ng mga jams na 'yan or yung mga spreads, mga Nutella, ganyan, so double sugar. Yung mga unnecessary na ganyan, 'pag tinanggal natin at bigyan lang natin ng whole foods yung mga bata, normally that will already, be enough to put them in low carb without necessarily na ikikito mo sila. Okay, so just eliminating all these processed food, yung mga fake food, right? Mga food na napakaraming additives and transition them to natural. For example, snacks, bigyan nyo ng nuts. Bigyan ng peanuts, bigyan ng, kung merong resources, walnuts, mga ganyan. Pakainin ng avocado, pakainin ng niyog, buko, right? These are natural foods. Pakainin ng mga isda, karne na kayo mismo ang gumawa, right? That will be already enough sa mga bata. You don't necessarily have to put them keto, but back to your question, recommended for a younger age. Mas maganda kasi that sasanayan mo sila na hindi talaga high carb yung diet nila. Kasi once masanay na ganun, then you're putting them at risk for insulin resistance at such an early age. So, I think, personally, ako, because we eat low carb dito sa bahay, then my son, he's 12 years old, he is eating low carb as well. I'm not necessarily putting him, low carb na sinasadya, but it's just the way we eat. And he's okay with that. Okay? Sino pa po ang may tanong? Yeah, so Miss Karen, it is important. I think it's a good practice para lang ma-establish na yung iyong bill of health ay okay. At kung hindi naman, at least alam mo, like for example, you have metabolic diseases like high cholesterol, mga ganyan po, high blood pressure, then at least masuri ka muna ng doktor talaga. For me, I think that is important. When I see a patient and I start them on this lifestyle dahil, nakikita natin medyo may konting issue sa metabolism, I always start with a blood test. It's important to check kasi marami din pong ibang mga sakit na hindi naman talaga lifestyle related na baka hindi ninyo alam na meron na kayo. So it's important to do that as part of preventative health anyway. So I would do it. Tingnan pa po natin. Sino pa po may... Ang chia seed, kailan po yung tamang oras para inumin? Doon po sa inyong non-fasting hours. So, chia seed, it's a great fat source, great fiber content. You can have that doon sa time na kayo ay non-fasting. Wala naman siyang specific na timing kung kailan nyo siya kakainin. It's just like any other food. Kapag fasting kayo and you really want to maintain a clean fast, then huwag kayo kakain. So, kain kayo dun sa non-fasting hours ninyo ng chia seeds. Wala naman siya pong specific timing kung kailan. So, ito, when it comes to supplements, guys, so Miss Ikea said, nag-low carb siya 10 months na po, 74 kilos down to 57. Congratulations. So, that's around what? That's around 17 kilos. Wow. 21 hours minsan OMAD. Nag-take po ako ng Neocell Collagen with biotin. The most important thing with supplements, read the label. So I wouldn't know kung ano po ang content nito. First of all, look at the ingredient list. So dalawa yung titingnan nyo dyan. Number 1 would be the nutrition label. Tingnan kung baka may carbs, hidden carbs. Ikalawa, ingredient list. Ingredient list, kung doon sa ingredient list maraming mga questionable items na nandoon sa pulang bahagi ng ating food guide, then you have to rethink. Again, you don't necessarily have to supplement. You already reached your goal. You don't necessarily have to supplement. Ask yourself, why are you taking the supplement? Gusto niyo po ba mapalakas yung inyong buto-buto, mga muscles? Exercise is the key. Okay, so we cannot, again, out-supplement an unhealthy lifestyle. Ngayon, na-reach na po ninyo yan, bakit kayo umiinom ng collagen? What is it for? Ask yourself that first. And then ikalawa, read the label. So nutrition label plus yung ingredient list. And are there other ways that you can get what you want kung bakit mo tinatake yung supplement? Yun po yung take ko sa supplements. Sino pa po? So, Miss Desi B, thank you for asking. Hindi po ako nagtatanggap ng consultations. My practice is in Canada. So, ang lisensya ko po ay nasa Canada because I'm in Vancouver. Napakarami po nating practitioners, low-carb practitioners, Doc Fee and Doc Mike. Punta po kayo sa Low Carb Con page kung nasa Philippines kayo. Doc Fee and Doc Mike are taking patients. Doc Grace, she doesn't take patients right now, but she has her master classes going on. Baka makatulong po sa inyo. Dr. Brian from EBS Wellness, more on pediatrics. Si Dr. Brian, we have si Doc Suzette. I'm not sure kung nagtitake siya ng online consultation, but Doc Suzette, Low Carb MD. Hanapin niyo po yung page, Doc Suzette. She's a diabetologist. Si Doc Kim Espiritu is OBGYN. And we have another doctor. Hindi ko na maalala. Tingnan niyo po doon sa Low Carb Con page. Currently, ako po I'm not accepting patients at this point. And kung sakali magpapatingin kayo, dapat Canadian. Kasi Canadian po ang aking license. Pero right now, I'm not taking patients po. Dito na lang po magtanong kung or pa-konsulta sa mga doctors sa Philippines kung nasa Philippines. Tingnan po natin. Sino pa po may tanong? Maybe 2 more questions and we'll call it a day. Okay, yung cashew. Is it high carb? Opo. Higher carb po siya compared sa ibang nuts. Kung titingnan po natin ang ating food guide, makikita po natin dito yung mga nuts na nire-recommend natin. And cashew is one of the higher carb nuts. So hindi po natin siya nire-recommend. So, yan po yung food guide. Paki-send ng message po sa Iris Radev MD. Huwag po magko-comment dito. Just send a message, Iris Radev MD. And yung staff ko po, team member ng Iris Radev MD will send you the PDF. Paki-message lang po doon. Sino pa po ang may tanong? Maybe one more. Okay, si Miss Cora Castillo. Nag-fasting ako, sumasakit ang tiyan ko. 11 a.m. po, simula ng fasting po. Paano po kaya yun? Miss Cora, kayo po ba ay nag-low carb na? Yun ang pinakaunang tanong. Kasi you cannot jump into fasting right away na hindi pa kayo nag-low carb basta-basta. So yun muna yung unang tanong doon. Ano po? Ikalawa, kasi you will have so many side effects from fasting. Kung ang katawan ninyo hindi sanay, hindi pa adapted to using fat for fuel. Ikalawa, there are also other underlying, again, dito na naman pumapasok yung organic causes. There are other underlying issues na nagkukos ng pagsakit ng tiyan. So the most common is H. pylori infection, especially sa ating mga Asians. So that has to be ruled out po. So kung GERD lamang ang dahilan na yan, the GERD will improve. So GERD is the gastroesophageal reflux. Mag-i-improve yan with your weight loss and with your low carb and fasting lifestyle. Pero kung may iba pa po yung kadahilanan, like for example nga H. pylori, hindi po yan mag-i-improve. Kasi H. pylori is a bacteria. It needs to be treated in a different way. Antibiotics po ang kasagutan dyan. So, again, ease into the lifestyle. Pasuri po sa doktor, pa-check muna, baka may H. pylori. Kung wala naman, that's great. Back to the foundation, mag-low carb po muna tayo. Once tayo ay very, very adapted na sa paglo-low carb, mismong katawan na natin na magsasabi sa atin na yes, you can go into long fast kasi mismo yung katawan, ano yan natural progression yan. Pag nag-low carb ka, hindi ka na magugutom. Yung mga kalam-kalam ng sikmura, mawawala yan. So, natural progression niya, makakapag-fast ka na ng matagalan. Pero you won't be able to sustain fasting kung ikaw ay hindi pa sanay sa paglo-low carb. Remember, this is the foundational basis. It's always the first step. Nilagay ko lang dito na 1 to 2 weeks, but in reality, it may take longer than 1 to 2 weeks. Depende po sa inyong sariling metabolism. It can be as long as 1 month sa ibang tao. But the key is step 1, go low carb po muna. Okay? Ms. Cora, and one last question siguro. Okay, Ms. Jess Arce, this is a great question. Nagkaroon ng plateau. Pag low carb nag-start ng 16-8, 6 months, what do you recommend? So, ito pong plateau, very common, ano po? Very common ang pagpa-plateau. Remember, pinag-usapan natin dati, lagi kong binabanggit, meron tayong fat thermostat sa katawan. Itong fat thermostat na ito, lagi niyang ita-try ibalik yung dating weight natin. So we just have to, kung nakikita niyo yung mga members ng community natin, yung mga, and i-guest ko sila, like nakita ninyo, si Coach Hernan, he's been doing it for 3 years already, Dodong Gala, and in the future, i-guest po natin si Miss Jen, who's been doing it for 3 years na, abangan ninyo yan, and then ginas natin si Mrs. B recently. If you haven't followed our coaches too, please follow them, para po sa practical tips din, ano, at makita ninyo, kasi sila, they've been doing it for quite a while. So the thing with this, Miss Jess, number 1, this is a marathon. Okay, so marathon siya, hindi siya sprint. It's great you've already lost the weight. Karamihan ng weight loss na nangyayari in the first few months is water loss. Okay, sa pag-lose kasi ng, pagbaba ng asukal, magkakaroon tayo ng depletion ng fat stores in the liver, and many of these weight loss talaga, yung mga kilos na nasa shed ninyo, is really water loss. Ngayon, the thing is to persist. Kaya ako sinasabi itong marathon because in some people, fat adaptation takes longer. So, yung iba, maswerte kung yung kanilang fat adaptation, yung transitioning from sugar burning to fat burning ay nangyari within, let's say, that amount of time, 6 months. Pero, sa iba, you will need to be consistently eat low carb. So, yun number 1. Ano po, hindi porke, kasi yung iba dyan, porke nag-lose na ng weight, nagsa-start na yung tinatawag na carb creep. Nag-lose na ng weight, medyo naging lax na sila, start na ulit kumain ng carbs pa unti-unti. Hindi nila siguro masyadong pinagtutuunan ng pansin kasi sabi nila, kaya naman yan, ganon. But carb creep is already happening. Slowly nagki-creep up yung pag-i-introduce ng carbs. Ang mangyayari dyan, magpa-plateau ka talaga. So carb creep, ano po, number 1. Number 2 is, there are other factors in play here. Sometimes people also go into, kasi in the beginning, people can be so calorically deficient. Ano po? So binabaan masyado yung calories. Tandaan po dito sa ating lifestyle, we don't, necessarily want to count calories kasi minsan nangyayari dyan, nag-a-adjust yung ating basal metabolic rate. Ano, yung energy consumption ng katawan natin. Nag-a-adjust yan. And that actually is the reason why I talk a lot about the fat thermostat, kasi pag mag-adjust yan, ibabalik ka niya dun sa dati mong weight. Ita-try ka niyang ibalik dun sa dati mong weight. And so, kung ang iyong BMR ay magsuslow down dahil napakababa ng caloric intake mo, then naturally what will happen is if you keep eating the same amount, tapos nag-slow down na yung metabolism mo, dahan-dahang mag-i-increase yung weight mo. I talked about this very lengthily doon sa, actually topic ko ito, weight loss plateaus, doon sa low carb convention. Kung gusto talaga ninyo ng, deep explanation about this, nandun po siya kasi it's a long topic. Marami pong science behind it. I encourage you, punta kayo sa low carb convention page, and doon po yung accessible yung recordings natin para marinig ninyo yung full explanation ko ng weight loss plateau. Hindi siya kaya, abutin tayo dito ng oras. But anyway, make the long story short, consistency is the key. So this is a marathon, not a sprint. Take it from the people who have done this for quite a long time. Hindi enough na 6 months lamang. Consistency is important. You have to continue to be doing low carb. You may need to add movement, right? Kasi kailangan natin pataasin ang ating BMR. And the only way you can do that is you increase movement para tumaas ang muscle mass, para tumaas ang basal metabolic rate. Okay, so weight loss plateaus, also look at your life stage, right? Because hormonal factors like menopause will play a role in metabolism. So maraming salamat po. And again, for very thorough discussions dito sa mga katanungan po ninyo, napakarami po niya naming na-offer na mga insights. Mga kasama ko pong mga fellow doctors, advocates, doon po sa ating low carb convention. Paki-check po yung page kasi talagang it's a valuable resource. 2 days po yung convention na yun. Kung na-miss ninyo, isusulat po natin dito, admins, pakisulat po yung link ng ating low carb convention recordings para po, it's really worth your time. It's a great investment of your time and great way to learn more, learn deeper. Kung may mga katanungan kayo ngayon, maaaring nasagot na po yun lahat doon. Kasi it's a very, very thorough. Kaya naman namin ginawa talaga yung convention na ito was because, ito nga po, to address all these knowledge gaps when it comes to the low carb lifestyle, low carb fasting. So yun lang po. I will see you again sa mga followers po natin. Remember po ang ating platforms, the FSM, so Filipino Success Movement platform, is not only leveling up in your health, level up wealth din po. So very exciting tomorrow. Guest ko po is someone who will talk about the power of digital marketing para po iangat ang pangkabuhayan. One of the most amazing young millennial entrepreneurs who really transformed her life. So yung mga interesado mag-level up sa kanilang wealth, please go to SuccessCon. Kung meron tayong low carb con, meron din tayong SuccessCon. So SuccessCon is all about leveling up in your wealth. So level up health and wealth. Yun lamang po. I'll see you again soon. Bye everyone.